certainly the most common disease a dermatologist sees is atopic dermatitis. There's been name changes over the years, and when I was in veterinary school, I learned it as allergic inhalant dermatitis. Then we started using the word atopic dermatitis. Most dermatologists are now considering this to be more of several different triggers of atopy, and the use of the term atopic disorders is now most people's thinking. The underlying triggers for that can include food, environmental, and parasites, but some of the new exciting research today is with the whole process of immunotherapy. For many decades, the use of injections of allergens has been one of the mainstays for treating an allergic dog. These days we're starting to use some sublingual or under the tongue products. It's important to note that that's been available in people for a decade or two, and the challenge has always been, how do you just avoid the dog from swallowing? If we just give it orally and they swallow it, it just becomes expensive protein. So the answers have been to develop devices to literally spray the product either into the gums or under the tongue. It's important to note, though, that you just can't take normal injectable allergens and squirt them in the mouth. The concentration of the product is higher, needs to be higher. There's other changes. Most of the time they're in a glycerin base, and as I say, there are special devices. But it's exciting because this can open up some new avenues for patients who in the past maybe were not amenable to receiving injections. Either the client couldn't do it or the dog didn't like it. There's also the possibility that with this different route of exposure, we may actually see a better response to immunotherapy. So it's possible that patients who have failed the conventional, traditional injectable forms may now show more improvement with some of these sublingual products. The other thing, another avenue that's being certainly looked at deeper with atopic disorders are some of our topical products, improvement of the barrier function. There's no question that that's a component of atopic disease that needs to be addressed, and products have been developed and more are on the way to help us with that. And there's a whole slew of pharmaceutical agents coming our way as well, as we get better understanding of the true process of atopic diseases and better pharmaceutical options with hopefully fewer side effects.